your host, Marsha Florence for Just Ask. Today our show is the American Diabetes Association. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today our show is the American Diabetes Association, and our guest is Holly Anderson, Program Manager for the American Diabetes Association, and Sharon Goodsell, RN and Certified Diabetes Educator. Hi, ladies.
Hi. Hi.
Glad to have you here.
Thank you.
Thank you. Now, Holly, we're going to start off with you. We want to know a little bit about your role there at the American Diabetes Association and the mission.
The mission of the American Diabetes Association is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. That includes people who have diabetes and the people who care for them, whether that's their family or their friends or the professional people out in the community like doctors and nurses who are caring for people with diabetes.
Okay. And your role as a program manager is?
My role as a program manager is to provide information to people in the community, whether that be professional people or people with diabetes, and just to give them information about diabetes, the importance of it, the seriousness of it, and to discuss best ways to care for themselves and keep themselves healthy.
Okay. Now, everyone knows normally when somebody says, I have diabetes, but most people don't know that there's two types. So what two types are there?
That's correct. There's type 1 and type 2 diabetes. Primarily, type 1 diabetes was mostly affecting children when they were younger, and what that is your body stops producing insulin in your pancreas, and so that you need insulin in order to break down your food, and you have to inject that into your body if your pancreas isn't already producing that. Type 2 diabetes was primarily in adults over 40. That has changed somewhat in the last few years. We are seeing an increase in children with type 2 diabetes, and it is mostly because of a sedentary lifestyle, lack of exercise, poor diet, things like that.
Okay. Now, the term used to be juvenile diabetes. Is that where diabetes 1 originated from?
That's correct. Type 1 diabetes was originally known as juvenile diabetes, but you can really get type 1 diabetes up into your 30s, and because of the increase in children with type 2 diabetes, we don't call it juvenile diabetes or adult onset diabetes anymore, because the lines have been so skewed, and so many people are getting it at a younger age.
Okay. What are some of the symptoms of diabetes, though?
Some of the signs and symptoms are frequent urination, being incredibly thirsty all of the time, a general fatigue and run down, but sometimes there are no symptoms. A lot of people live for quite a few years with type 2 diabetes and have no idea that they are even affected.
Okay, and I think that's a lot of people's concern, because as you say, fatigued and a little run down, constantly thirsty, and what was the other one?
Frequent urination.
Okay. I don't have all three of those, but I do have two. Okay. Like, I'm a little tired now. Okay. No, okay. But basically, so normally you have to only find out from your physician, or is that the main signs, those three?
Well, those are some of the signs. We encourage people to have their blood checked once a year if they are at risk for diabetes, if they have a family member who have diabetes. Okay. And as you age, that's certainly an important thing too. Maybe once a year at your physical, when you go visit your doctor, ask for a blood glucose test. And they would just take some blood, test your blood glucose levels, and that would be able to tell your doctor whether or not you have diabetes.
Okay. Do we have a high risk population in Michigan?
Michigan is affected more than quite a few other states. We actually have the 4th highest prevalence of diabetes in the country, and that a big reason for that would be because of we have more of a sedentary lifestyle. It's cold in the winter. People aren't outside exercising as much. There's also a lack of access to exercise facilities in Michigan, and that causes obesity, people who are overweight, and that puts them more at risk for type 2 diabetes.
Okay. But does diabetes affect more one race over the other, or another population over there?
Actually, every ethnic group besides Caucasians are higher at risk for diabetes. Okay. African Americans, Arab Americans, Latinos, they are all disproportionately affected by diabetes.
Okay. Okay, that's a lot. Okay,
Yes.
that's a lot to think about.
It is.
So mainly, a person should automatically get checked out for diabetes when they go to their health physician.
We encourage that, yes.
Okay. Okay. Well, Sharon, we won't leave you out. Sharon
Okay.
Goodsell. Sharon, you're an RN as well as a certified diabetes educator. As an educator, what do you do?
We help people to learn how to manage their diabetes. They're diagnosed and they go, oh my, what do I do now? So we sit down with them, help them to understand what diabetes is, what they need to do to manage it. The doctor prescribes the medications, but how to take them, when to take them, what to eat, when to eat, how to manage stress, how to take care of their feet and their skin and their mouth. There's many aspects of managing diabetes, as well as checking their blood sugars on a daily basis so they know, they get feedback from the efforts that they're putting forth in trying to watch what they're eating and so forth, that this is working or this is not working.
Okay. But once you're diagnosed with diabetes and you say start to watch what you eat, does a nutritionist play a role with the person?
Absolutely. We have registered dietitians that are also certified diabetes educators. And if somebody is looking for a program with education, they can contact the American Diabetes Association and get the names of the hospitals that are recognized by the American Diabetes Association. It's a type of certification that assures the person, the family, the physician that they're getting quality education.
Okay. Okay, now I've heard this and I'm not sure, so I want you ladies to clear this up. A person with diabetes normally cannot just get a regular manicure and pedicure. They need to go to is it podiatrist or something to get their nails clipped? Okay, is there a particular reason why?
Well, their feet are vulnerable. High blood sugar can damage the blood vessels, and down in the feet you have tiny little vessels, and if they become damaged, then the blood doesn't get down there to carry the nutrition. So you want to have your feet checked on a regular basis by your physician or a specialist, which would be a foot doctor called a podiatrist.
Okay.
Cutting your toenails and injuring yourself, bathroom surgery as we like to call it, can cause problems that are slower to heal, which is another warning sign of diabetes. So if they have somebody who's professionally trained to trim the nails, they're less likely to develop an infection.
Okay, okay. And I think a lot of people don't know the seriousness of that, okay? I want to get my toenails cut, you know. Can I just cut them myself, or why do I have to run to a podiatrist to get my toes cut? Is it the mere fact that if you actually injure yourself and cut yourself and start to bleed or something, that something could occur?
Well, any kind of injury is more potential for infection. Infections heal slower in people with diabetes, so it can be the beginning of a big problem.
Okay.
Now, if they can see adequately and their toenails are not real thick or hard to cut, perhaps they can do their own and just check in with a podiatrist once or twice a year.
Okay.
But if it's a senior or somebody who's limited in trying to reach their own toenails to trim them safely, then they should have somebody else help them.
Okay.
It could be a spouse, it could be a family member that's trained to do that, but if they don't have access to those kind of resources, then a professional.
Okay. Can you give us an example of a diet plan? What would be a good day? Give me an example actually of a good meal for a day or so.
Well, we used to have what we call ADA diets, and they were handed out, and this is what you follow, and this is what you eat, and this is what you don't eat. But now what we tell people is you can eat anything you want. It's the correct amounts at the correct times, and so it needs to be fit to the individual. You need so many carbohydrates, so much protein, so much fat, depending on your activity level, depending on other medications, depending on other health conditions. If you have high blood pressure, certainly we want to watch the amount of salt intake. If you have high cholesterol, then certainly we want to watch the amount of fat, the saturated fats. So it depends on the individual's needs and their activity and so forth.
Okay. Well, what's the theory on sugar? Can any one of you ladies tell me? Some people eat so much candy, including myself, but some people eat so much candy that sometimes we look at you and say, you know what, it's no wonder you don't have diabetes, all that candy you eat. I mean, some people wake up eating candy, all day nibbling on candy, go to bed, got to have some candy, and it's not necessarily chocolate, it might be hard candy. Some people actually just live on candy. Is there a myth connected with diabetes about sugar intake?
Yes.
Absolutely.
Okay.
That is a huge myth for diabetes, is that eating too much sugar causes diabetes, and that's not the case. You need to be aware of how many carbohydrates you're eating in a day, and certainly sugar is allowed to be included in that as long as your meal plan allows for that and you're following the correct diet that has been set up by you by a certified dietitian and a diabetes educator. And as long as you're following that, then as Sharon mentioned, you can certainly have candy or chocolate in your diet, and it does not cause diabetes.
Okay, okay. And I had a question. I'm sure that the audience is like, ask her something about insulin. Okay, if a person is on insulin, I noticed that some of my own family members, for example, may have an insulin shot just anywhere. What does that mean when you can just, insert the needle anywhere? I mean, does the insulin automatically just go through the blood system quicker, or because some people don't have time to really find the vein or whatever, so they might shoot themselves in the stomach, in the buttocks, or whatever. Does that mean anything when you do that?
Yes. We have certain areas that are more what we call fatty or subcutaneous layer, and so there's certain areas not into the muscle. So you can use the thighs, you can use the abdomen, you can use the arm back in this area back here, the outer part of the buttocks, and so forth. The insulin is absorbed into the bloodstream, and then it goes in and picks up the glucose and carries it into the cells. Okay. And so the insulin is there to help replace the work of the pancreas.
Okay, okay. All right, because I wonder about that. Sometimes you see people and they say, oh, I got to take my insulin shot. It could be just anywhere, So I was wondering, was there, that was supposed to be expedient for the insulin to actually take place. What happens if a person actually misses the shot?
Usually what will happen is their blood sugar will go higher because either their pancreas doesn't make enough insulin. In the case of type 1, their pancreas doesn't make any insulin, so their blood sugars will go extremely high. In the case of a type 2, it'll go higher, and they may have problems. So taking your insulin on a regular basis as prescribed, whether it's 1 to 4 times a day or more, is very important to help control your blood sugars.
Okay, so there's no such thing as a substitute by eating fruit, drinking a pop. I mean, you see some people say, I need a pop or I need a piece of fruit. What does that mean?
That could mean that their blood sugar is going too low. Diabetes is really a balancing act many times of going too high and too low. If it goes too low, that can be as urgent of a need to bring it back up as going too high. If they go too low, they get shaky, sweaty, trembly. They need to have certain amount of pop or sugar or glucose tablets, something to bring it back up to a safe level, because you can get very confused at that lower levels and eventually convulsions, coma, or death. So it is a very serious condition in people with diabetes, that they keep their blood sugars at an even keel, so to speak.
Okay, so elevation is important for the blood sugar. Okay, well, I hope I asked enough questions for you ladies. So what we're going to do is take a commercial break and come back with some more good questions. Thank you.
Your time is gonna come. Your time is gonna come. It's up to you to reach out to be that friend who comes along. Your day is gonna come.
When you make a friend, you make a difference.
Your day is gonna come.
Friendship, pass it on. A message from the Foundation for a Better Life.
Hi, I'm your host, Marsha Florence for Just Ask, and welcome back to the second half of the show. For those of you who are just now joining us, we're here with the American Diabetes Association, and we have as our guests Holly Anderson and Sharon Goodsell. Okay, now ladies, we left off with some good information here, and I know a lot of people are going to call and ask 99 questions about diabetes, but we want to go back to tell us some of the programs that the American Diabetes actually offers out.
We have quite a few brochures and a lot of information that we send out to people who call us on a daily basis and are really interested in their care for diabetes and how to take care of themselves in the best manner. If they need a doctor, we certainly can give them some names of people in their areas. If they are interested in going to a certified diabetes education program, if they're interested in a diabetes support group, we provide them information with what's in their community. We also refer people to other organizations that might be helpful if they're dealing with an issue that we can't help them with. We can refer them to a place that that can help them. We also have patient programs, and we have a couple of them coming up this spring. We also have a diabetes expo coming up this fall where people can learn, again, more about the care of themselves with diabetes and for family members, so they can learn how to care for their family member with diabetes or their friend. It's also good for physicians and nurses and people who deal with diabetes in the medical community.
Okay. Are there any specialized senior programs or low-income family programs available?
Well, we do have what's known as Diabetes Sunday program, which is in the Detroit area, specifically in the city of Detroit. If you have a parish nurse maybe at your church or are affiliated with a specific church, during different Sundays throughout the year, the American Diabetes Association comes out to different churches and provides information to people who might want information on diabetes, might want to know if they're at risk, might want to know how to care for themselves if they already know that they have diabetes.
Okay, okay. So actually you all go out and make presentations?
Absolutely.
Okay.
We do that.
And it can be at any given time?
We go to health fairs. A lot of times people will go to a health fair put on by their community, again, their church perhaps as well, and a lot of times you'll find the American Diabetes Association there providing information.
Okay. I'm sure the churches would be flattered to have you all come out and, speak to the congregations, because most of the time, not the majority of people with disabilities go to church or have diabetes go to church, but this way those family members who are attending church can go back and relay some information about a speaker's presentation in reference to the services. So I'm sure this will go over well, because a lot of the churches will call you now. So we could get them to come and tell us, and the more the information gets out about services, the better off, the public is, because a lot of people don't like to read. And by not wanting to read or, don't have the materials to read, when they see programs like ours, then they get a better chance to understand what the services are from an agency. And the Diabetes Association has got to be one of those a lot of people are concerned about. Okay, so and you start getting phone calls, you know why. Okay. Sunday special. So you have volunteers to go out and speak at the church?
We do. Thankfully, we have a lot of very helpful volunteers. We have a small staff, so to have, 100 churches call and want us to come out is a difficult thing to do. We do have a lot of wonderful volunteers who go out and help us out.
Okay, so we know you have some phone numbers there. So if someone was interested in getting some information from the organization, what number would they call?
If you're interested in getting information about diabetes and about diabetes care, you can call our local Southeastern Michigan office. The phone number is 1-888-DIABETES. That's 888-342-2383. Okay. We also have a website, and that is www.diabetes.org. Okay. And if you want to make donations to the association, you can call us at that same number, 888-DIABETES.
Okay, okay. All right. Now, Sharon, I want to ask you something about being a certified educator for the Diabetes Association. Now, are you a volunteer as well with the Diabetes Association as a certified educator?
Yes, I am. I have my own employment that I work at a local hospital, Garden City Hospital, and I'm a diabetes educator there, but also I volunteer time for the American Diabetes Association. I serve on several committees, and Holly will frequently call and ask if I will do a program at some location or community center or so forth. So I feel that that's another way of reaching out to the community and helping out.
Okay.
So
that's a wonderful thing. Okay. Okay, and it's always good to volunteer for something, and you learn about a lot of organizations, and you put forth the effort to volunteer. You learn about the services and the resources, and you'd be surprised, how far you go with volunteering. Because actually, I think anyone in the helping profession it has a kind heart. You wouldn't be in the business if you weren't. You can't just go out and say I want a job when you work with the public. You got to be ready for it and know that you have a heart to want to be able to contribute to the community.
And diabetes is such a serious disease. It's actually been called by the Centers for Disease Control the epidemic of our time. And the numbers are just staggering how many people actually have diabetes in Michigan and across the country. And it's only getting worse. So we definitely are trying to provide a service to the community and get the word out that diabetes is serious, that people are at risk and that you may have it and not know it.
Right. My main concern about diabetes, though, is when children have it. How is it diagnosed so early in children?
Well, like I mentioned before, it's a problem with your pancreas, that it's not producing insulin on its own. You can get it up into your 30s, and your pancreas just stops working correctly to break down your food. And there can be no rhyme or reason. Sometimes people have a family member who have had type 1 diabetes. That puts you at a slightly higher risk. For example, if a father had type 1 diabetes and had children, his children were at about a 7% higher risk to get type 1 diabetes themselves. But it doesn't necessarily mean that they'll have type 1 diabetes. It doesn't necessarily mean that they won't have diabetes. So there tends to be no rhyme or reason with type 1, but certainly you are at a little bit higher risk if you have a family member.
Okay, what about pregnancy? Is that a risk for pregnant women?
There is a condition called gestational diabetes that women can get when they are pregnant, and most of the time it goes away after they've had the child, but that's not always the case. And after they do have a child, they are at higher risk to get type 2 diabetes later in life.
Okay, okay. So you're not just tired from having the baby. could have diabetes by now. Not only did I have the baby, I might have diabetes. Okay, I know pregnant women are not too happy about that. Okay, but that's good to know that they can be tested along the way to make sure that they don't have.
And most physicians will do that in a certain month of their pregnancy. They'll have, they'll test them. They'll have what's called a glucose tolerance test as well.
Okay. Now, there's some new things on the market, so do most patients have an option to take a pill now as well as the insulin shot? Is there such a thing as this pill that's out?
Since about 95, we've had about 10 new medications come on the market. Previously, insulin was discovered in the 1920s, and that's all we had until the 1980s. And then for pills, in the 1960s, the first pills came out, and the second generation came out in the 1980s. So we've been very limited until about 95, and with the 10 new medications, it provides a lot of more options for people. They can use insulin, they can use pills, they can use combinations. It used to be thought that for type 2, insulin was the, I failed, therefore I have to go on insulin. No, insulin is more of a helper to work with the pills to get the blood sugars under control. And we know now that control of blood sugars is so vitally important because it reduces the risk of complications. We've had 3 major studies in the last 10 years that have shown that the closer the people keep their blood sugars to the non-diabetes range, the more they can reduce the problems with eyes, problems with feet, problems with the kidneys, and so forth. That at one time people thought was just a result of having diabetes. No longer has to be.
Okay. But I know someone in the audience is probably saying, if I eat right, and I work out, and I check with my doctor bi-monthly to make sure how I'm feeling is okay, can I come off of insulin? Is there such thing?
It depends on if they're type 1 or type 2. It depends on what their pancreas is doing. It is, yes, some type 2s need insulin for a short period of time and give their pancreas a rest, and then the pancreas can start working and they can come off the insulin. Or with new medications that are coming out, sometimes the new medication will control the blood sugar. So it really is an individual situation. It is true some people can come off insulin, not all people.
Okay. Because I hate to find out people just say, well, I'm feeling better. I'm going to stop taking this. Sometimes this makes me a little sleepy, a little nausea, things like that. A lot of people have excuses for why they feel they shouldn't take the medication. I've got to go to work. This stuff makes me tired. So if they have, side effects from their insulin, then they may not want to take it. But they feel like, well, if I eat right and I exercise, that should be enough for me. You know, and I'm the kind of person, if the doctor puts you on it, it's for a reason, you know, so it doesn't mean you yourself can just slide off of it and be done. But some people are critical to the fact that how they felt before they started taking the medication, and then now that I'm taking the medication, I have another feeling. So is there any recommendations about, you know, how people should monitor themselves before they just completely quit?
Oh, absolutely. You need to work with your doctor and your healthcare team. You're all working together for the good of the person. And to go off insulin without talking with somebody and finding out other options is going to increase your risk for problems. It's just going to increase your risk. Working as a team, with everybody working together to find the answers and the solutions, is what we suggest.
Okay, okay. Well, that sounds wonderful. So we do know that you can work with your physician and a nutritionist or a volunteer certified educator to get more information on better care for yourself or for your loved ones who have diabetes. Okay, and that's a good thing, because a lot of times if children have it, people are concerned with, well, my child doesn't play like he or she used to, and they're not as active as he or she used to, and by them being young, I don't think a lot of people are prepared for their children to have diabetes at an early age like that. So is child diabetes or level 1 diabetes, is that just as critical as for children as it is for adults?
It's very critical. Type 1 diabetes affects, especially when a child gets it at a very young age, it affects the entire family. It's usually a very overwhelming thing for parents to have to deal with, particularly when the children are not old enough to care for themselves. If they're infants, they don't know how to give themselves an insulin shot. They don't know how to test their own blood sugar, and the parents need to learn how to do that and to care for their child while they're at home. And we have some wonderful things like diabetes support groups for families, for kids with diabetes, for adults with diabetes, for families of children with type 1 diabetes. It is an incredibly overwhelming thing, and there actually is a high incidence and a high rate of depression in people with diabetes, whether that is children or that's adults, because diabetes can be a very overwhelming thing. It is one of the only diseases where the patient has the control. If you have, let's say, cancer, you go to the doctor and you have chemotherapy or radiation, things like that. When you have diabetes, you have to care for yourself on a daily basis by testing your blood sugar and making sure that you're healthy, checking your feet every day, and giving yourself insulin or taking oral medications. And that can be very overwhelming to a lot of people. And like I mentioned, there's a higher rate of depression in people with diabetes than in the rest of the population. So it is a very overwhelming thing. But people do a wonderful job. They have, like I mentioned, diabetes support groups, wonderful diabetes educators who walk people through the issues that they're dealing with on a daily basis.
Okay. Well, ladies, we can't say, but we have to have you back for part 2, because I can tell a lot of people are going to give us a call or give you a call and ask for more, information, because it is very important that they understand the health care and be more conscious about their health. So, Holly, before we go, we need those numbers again.
Okay. Our office number for the Southeastern Michigan office is 1-888-DIABETES. That's 1-888-342-2383. You can also get on the web and check out our website at www.diabetes.org.
Okay. Well, Holly and Sharon, thank you so much.
Thank you.
We look forward to having you back. So, please prepare.
Absolutely.
Okay, thank you.
Thank
Well,
you.
ladies and gentlemen, of course, you've heard some very good information here today about the American Diabetes Association, so I know you're going to have some questions. Please feel free to use the number that Holly gave out or the website, or call us here at the Just Ask hotline, which is a 24-hour hotline number, 248-988-0250, 248-988-0250. Remember that this show is dedicated for you, the people of the community. We'd like to find out what you think. Give us a call or write us, let us know. Any upcoming shows that you'd like to see, please drop us a line. So you know who I am. I'm your host, Marsha Florence for Just Ask. And what do I always say? If you know someone with a disability, don't be afraid to ask. Just ask. I'm your host. Thank you.